Good afternoon, everybody. Thank you for joining us this afternoon. We do these webinars every month, and typically it's the second Wednesday of the month, and we try to discuss topics in orthopedic medicine that are of interest to our patients and to the public. And today's topic will be on rotator cuff tear and the non-surgical treatments and innovative treatments for this condition. I will be joined by Dr. Chris Rogers, who is here with us.
Good afternoon, wherever you're finding us. Taking a break from the news, I hope, and getting a little medical education. Looking forward to sharing with you some of the new treatments that we have available at our clinic.
So this will be a short presentation. It will be a 20-30 minute presentation about the topic. We would like to spend more time in answering your questions about this condition and any other questions that you may have regarding platelet-rich plasma or any other orthobiologics like cell-based therapies from bone marrow or fat tissue or adipose tissue. So as I mentioned, Dr. Chris Rogers is here with me. He is the founder of our medical practice, San Diego Orthobiologics Medical Group. I joined him about 2 years ago from my practice in Los Angeles. We're both board certified in physical medicine and rehabilitation. This is a specialty that diagnoses and treats non-surgical orthopedic conditions. We are also fellowship trained in interventional spine and interventional pain management procedures, as well as regenerative medicine. Regenerative medicine is a new medical specialty that deals with the science of cells and tissue engineering to treat orthopedic conditions. And we are nationally recognized experts in this field. We have decades of clinical experience with our specialty and regenerative medicine, and have been fortunate enough to be invited to participate in clinical trials, have them published in peer-reviewed journals, and contribute to book chapters. We're also currently conducting FDA-approved clinical trials for stem cell therapy for both knee osteoarthritis and also clinical trials for degenerative disc disease for low back pain. So these are pictures from us being invited to participate and lecture in medical conferences and workshops where we are able to teach our fellow physicians and young doctors on regenerative medicine and how we apply this to our practice. And actually, that's how Dr. Rogers and I met. We were both speakers at this particular medical conference. So these are some of the book chapters in regenerative medicine where we have contributed chapters to. And this is our beautiful clinic in Carlsbad in North County, San Diego. For those of you who have been here, you're familiar with our big, spacious, state-of-the-art clinic here in Carlsbad. This is our procedure suite where we have the state-of-the-art equipments that we use for our procedures. On the right here, you can see the fluoroscopy machine, which is a live digital x-ray that we use to image the spine and also your extremities for the procedures. And on the left here, you can see a musculoskeletal ultrasound that we use to diagnose injuries in your joints, in your tendons, in your ligaments. And also we use this to assist us in delivering precisely the biologics to your injuries. This is our lab, our laboratory, where we process all our biologics, platelet-rich plasma, bone marrow derived cell therapies, and adipose tissue or fat derived cell therapies. And we are very strict with our protocols in maintaining our clinic to be safe and free, not only for ourselves and for our employees, but also for the patients, to make them comfortable to come in. Everybody is strictly screened. We disinfect our office regularly, not just with sanitizers and with UV lights, do temperature checks, and we do telemedicine visits as much as possible if you don't need to come into the office. This is what the UV light looks like. Okay, so objectives for today, we're going to talk about rotator cuff injuries. We're going to talk about the non-surgical treatments for this condition with a focus on cell-based therapies from bone marrow derived tissue or adipose tissue. And we're going to talk about platelet-rich plasma. We're going to present the scientific evidence for these treatments, and we're going to end with a question and answer session. So first, let's define what a tendon is. A tendon is a connective tissue that connects your muscles to your bone. Is this strong fibrous structure or collagen that helps transmit the load from the muscle to your bone. They can be injured acutely through a traumatic injury that's creating a tear, or over time through a chronic injury by wear and tear or degeneration. Tendons have a poor ability to heal because they have a poor blood supply, but also because they are constantly being loaded with stress. And tendinopathy is a condition which is the primary disorder of these tendons due to overuse and due to chronic wear and tear or age-related degeneration in the tendons. What happens is that your tendons get stretched, they get worn out, they create micro tearing in the fibers, and eventually the tendons thicken over time, can create obvious tearing into the tendon that can create pain, and the tendon tissue itself become of a less quality tissue when it has less tensile strength and poor mechanical properties compared to a normal tendon. So we're going to be talking about rotator cuff muscles and tendons today. Rotator cuff muscles are these 4 muscles that are located in your shoulder, and their main function is to stabilize your shoulder joint in place. There's 4 of them, and they are these muscles that are listed here in the red circle. You've got the supraspinatus muscle that aims to or works to elevate or raise your arm. And then you've got the infraspinatus and the teres minor muscles that externally rotate or move your arm outwards. And then you've got your subscapularis muscle that internally rotates or moves your arm inward. And the basic function of these rotator cuff muscles is to raise and rotate your arm, as mentioned. They're inserted right in an area which is a space that is bordered by your shoulder joint and your collarbone. And that's why there's a common injury to these muscles just because of its location. When you move your arm upwards, it naturally narrows that space and makes it more prone for impingement. Some people are also born with a curved acromion wherein the collarbone actually curves inward, thus making that space even smaller and making you more prone for rotator cuff injury. So as I said, rotator cuff disorders, they're one of the most common musculoskeletal complaints that we see in our clinic. They're found in almost half of the population more than 50 years old. And as I said, it was caused by trauma. That rotator cuff tears can be caused by trauma or age-related degeneration. Traditional management for rotator cuff disorders include anti-inflammatories like your Advil, aspirin, or ibuprofen. They help to decrease the inflammation and help with the pain. Analgesics like Tylenol also help with pain. Physical therapy aims to improve the strength of the support structures and prevent injury from happening again. And if all these fail, patients typically get steroid injections. You're all familiar with cortisone injection, which is an anti-inflammatory injection that helps decrease the inflammation and helps with pain. The advantage of this injection is it gives you immediate relief. The disadvantage, however, is it doesn't take care of your injury. It's short term. And in fact, they have been shown to actually worsen the quality of the tissue where you inject it to, and even worsen arthritis if you inject it into the joint. So there has been variable rates of success for these treatments, 15 to 85%. With physical therapy, I think giving the best of the results. It used to be that patients only had two options, either treat it with traditional treatments, and if they fail, have rotator cuff surgery to repair it. And as we have mentioned before with regards to surgery, it's really very individualized with regards to the decision on, on if we need to proceed with surgery or not. A athlete, for example, who is in play and who sustained an acute trauma will be treated differently than someone who has a more sedentary lifestyle, older patient who has a chronic rotator cuff tear. So everything is individualized. But for patients that undergo surgery to repair rotator cuff tear, they can result in improvement of pain, especially with their overhead activity, when you try to move your arm upwards, and it can improve range of motion. However, there has also been studies that have shown that rotator cuff repair, especially the ones that are degeneratively torn or chronic tears, when compared to conservative management, does not result in superior outcomes. There has been many studies comparing physical therapy outcomes with rotator cuff, degenerative rotator cuff tendon tear repair, which is fairly similar in outcome. Also, there's high failure rate that has been documented with a surgical rotator cuff repair, and that could go anywhere from 30% to 94%. And I think the main reason for this problem is because there's no good cellular healing at that surgical site. That interface when the tendon and the bone meet does not regenerate well after a surgical rotator cuff repair. Thus, this leads to a weaker tissue and scar tissue formation. So now there's something that bridges the gap between traditional treatments and surgery, which is a new branch of medicine, what we call orthobiologics, which are cell therapy treatments that is based on the premise that the body can heal itself. And that's what we're going to focus on in this talk. Orthobiologics are cells or substances that are derived from these cells that we use to treat orthopedic conditions. And they help augment our body's ability to repair itself and heal tissue injuries. Some of you are probably familiar with these orthobiologics. The most common is platelets, which is what we use for platelet-rich plasma therapy. Most of you are familiar with stem cells. Growth factors are proteins that are in the platelets that are involved in healing, and all other proteins that are involved also with the healing process that we use for treatment. So just like a farmer that needs seeds, soil, and fertilizer to nurture a seed and make it grow, we do the same thing in regenerative medicine. And we use the cells, which you can akin to the seeds. We use the growth factors, which works like a fertilizer to help nurture the growth of the tissue, and scaffolds, which is that structure that holds together in place and acts as a framework for the cells to work. So basically, we're farmers with what we do in regenerative medicine. So let's talk about the first orthobiologic, platelet-rich plasma. What's PRP? This is a concentrated solution of platelets and plasma in your blood that contains thousands of growth factors. It used to be that they thought platelets was just involved in clotting, but they have found that inside these platelets, they have thousands of growth factors that are actually involved in healing. They stimulate the cells that come to the region to start the healing process. They stimulate formation of blood vessels, tissue regeneration, and also they're anti-inflammatory. Not all PRP is the same. Some of you probably know this already, and that's why it's very important to choose a physician that's skilled in regenerative medicine and has the experience to know which treatment is the best for you. As you can see here, there's different kinds of PRP that results to different colors of PRP. The one on the left has high red blood cells and white blood cell counts. On the right, with no red blood cell and white blood cell count, and somewhere in the middle here is this amber colored PRP that's low in these cells. And different injuries or different conditions necessitates different PRP treatment. Like for example, for the spine, we will use this PRP on the right that does not have any red blood cells or white blood cells. And for the joint, we'll likely use the one in the middle. So a lot of patients tell us, oh, I had a PRP. There is no ultrasound guidance that was done. Uh, the PRP, we were not sure how it was prepared and they failed it. So we always ask, what kind of PRP was done. The composition and the concentration of the PRP is very dependent on the physician's expertise and experience in administering these procedures. So in the interest of time, we don't have time to discuss how we prepare all these orthobiologics, but we do have a YouTube channel where we have videos on how each of these orthobiologics are prepared. So if you go to YouTube and type in San Diego Orthobiologics, you can avail of these videos and other videos that we have prepared regarding regenerative medicine and different kinds of orthopedic injuries. So I'll have Dr. Roger take over the lecture for the second part of the webinar.
Thank you, Dr. Ambach, and thank you folks for joining us and sticking through. We'll answer your questions in about another 15 or 20 minutes. I think most of you are familiar with the term stem cell. What is a stem cell? First of all, the stem cell has a unique ability that is different from other cells. As you may know from high school biology, typically one cell, like a skin cell, can turn into two skin cells. But stem cells have the additional ability to turn into a different kind of cell. So that stem cell may make a copy of itself, and then it may also generate a new bone cell or a tendon cell. Now, originally, that was thought to be how these cells work in the body as a treatment. So we know we have these stem cells, all of us, anybody who's breathing today has stem cells in their body. Those cells are repairing the damage continuously every day. But then when we collect them and form a biologic treatment, we are collecting those stem cells for a different purpose, and that is for their ability to generate various molecules that stimulate the injury to heal. So these cells were first discovered in the 50s. You're familiar with bone marrow transplants. You know that children with leukemia or lymphoma, if they have a bone marrow transplant, those stem cells from the donor could generate new red blood cells, white blood cells, reconstitute that child's blood. And it's a life-saving procedure, and there are tens of thousands of cases done over the past several years even, and that's a treatment that has made a huge difference in the treatment of these patients. When we use stem cells in orthopedic applications, we're not using a donor cell. I think that's the first point I would like everyone to understand. I realize there are clinics who claim to inject cells from a donor, so maybe an umbilical cord blood or an amniotic fluid tissue, claiming that they're stem cells, but currently the FDA does not permit the use of those kinds of products. And the reason they do not permit it is because they have not been tested for safety, and they have not been tested for efficacy. And indeed, some patients have been harmed. Many patients have been hospitalized with infections and things like this. So when you go to our YouTube channel and you read about how we use cells from the blood or from your bone marrow or from your fat tissue, which contain these kinds of cells, just realize we're using your own cells. And I'm actually in the lab where we centrifuge and make a lot of these orthobiologic treatments. All right, next slide. So, so this is our friend, Dr. Arnold Kaplan. He is a professor at Case Western Reserve University in Cleveland, Ohio, and he is a giant in the field of orthobiologics. He first described this mesenchymal stem cell, which is a subclass of stem cells. Understand that there are many different kinds of stem cells. This particular stem cell, which he discovered and named in the 1990s, has the ability to turn into muscle or cartilage or bone, things that are very interesting to orthopedic doctors. And like I said, originally the thought was you could put these MSCs, these mesenchymal stem cells, into a patient and regenerate their cartilage or regenerate the bone. And as I explained, what they're really doing is they're talking to your existing cartilage, your existing bone, and encouraging those tissues to heal. Okay, next slide. And they do that mechanism through the release of growth factors. So Dr. Ambach talked about growth factors. These are molecules that are synthesized by the activated mesenchymal stem cell, and there are thousands of them, and some of them promote cells to proliferate and grow and manufacture collagen, which would be necessary for healing a rotator cuff tendon, or they release molecules that inhibit the immune system and decrease inflammation, which alleviates pain, much like a cortisone shot might do. And they even have the ability to fight infection. So stem cells have been used for treating infected wounds and things like this. Next slide. And as I mentioned, the FDA does permit the use of your own cells, so cells obtained from your bone marrow through a simple bone marrow harvesting procedure, which we do in the office, or from platelet-rich plasma, which comes from the blood. We take about 4 tablespoons of blood, or from the fat tissue. We do a mini liposuction procedure in the office and collect a couple tablespoons of fat, which will have millions of cells inside of it. Next slide. Yeah, and as I commented earlier, these birth tissues, amniotic tissue, umbilical cord blood, currently not permitted by the FDA. These products, by the way, don't have living cells in them. They've been irradiated in an attempt to sterilize them to minimize the risk of infection. And in that process, it basically kills all the stem cells if there were any in the product to begin with. Next slide. So there's been a number of published papers. When we talk about scientific evidence, we talk about our experience as physicians, how our patients are doing. I see some of you in the audience that are patients that I've treated in the past. Some of you folks I've treated maybe 8 or 10 years ago before we even had really good published studies. But since that time, we fortunately do have good scientific studies that have been published. This is one study by Dr. Miller. It's a systematic review of 16 randomized clinical trials. So a randomized clinical trial might be a study where you take 100 patients with rotator cuff injury and half of them get PRP and the other half get a placebo. Maybe they get, sugar water or something injected into the tendon. And in this analysis, it was shown that PRP is superior to a placebo, is superior to steroid, and these results can last 2 years or longer. Next study. This is another study, 39 patients with small rotator cuff tendon injuries. One group was injected with PRP. Another group was simply injected with a needle. No substance was actually injected into the tendon. They wanted to see if there was an effect of just putting a needle in the tendon. And indeed, you see pain scores decreasing over time, but the improvement was greater in the group that received PRP. This is a study conducted by our colleague, Dr. Chris Centeno, who's another pioneer in the field, who concentrated cells derived from the bone marrow and showed that patients were able to see improvement in their disability and their pain as soon as 1 month after treatment. And again, these results are long-lasting. One of the questions our patients ask is, how long will the results last? And we're happy to report that in many patients, a single treatment is all that's required. And when you come back and we ultrasound your tendon 6 weeks or 12 weeks later, we can see that that tendon has healed or nearly completely healed. And as long as you don't re-injure the tendon, then that's essentially a cure, and further treatments are not necessary. Here's an interesting study by Dr. Joe out of South Korea, where stem cells were taken from fat of patients and then injected into large rotator cuff tears. And they were able to also show significant improvement in clinical outcome scores. So we asked patients, how's your pain? How's your function? What's your range of motion like? And those scores improved with impressive improvements on MRI as well. That's another question we get, is what does the tendon look like after you've treated it? And in this study, 90% were improved on MRI, and they took it a step further. On this next slide, they actually went back and looked inside the shoulder. So on the left, you see 2 pictures of before treatment. You see large tears in the tendon. An orthopedic surgeon has put a little device in there to stretch out that tear and show you it. And then 6 months later, they go back in with a camera and they look, and you can see that the tendon has healed. So this is sort of a proof of concept that injecting cells derived from fat tissue can be helpful in healing rotator cuff tendons. These are some of our actual patients now. So, it's one thing to cite published studies. It's another thing to share our personal experience. I would say there's three important things to getting a good outcome with any patient. The first thing is the diagnosis has to be correct. So what you're looking there is a picture of an ultrasound of the rotator cuff tendon. If you look carefully, you see little white plus signs that are measuring a hole in the tendon. The black area is the hole in the tendon. The white area is the tendon. And so the first important thing is to diagnose accurately the cause of the patient's pain. The second thing is to choose the right orthobiologic. So can that heal with PRP? Can that heal with some other biologic? And then the third step is to use good technique in delivering that biologic to the injured tissue and making sure that you treat all the tissues that are injured, not just the one that's most obvious. So all those three things are important to getting a good outcome. And here you can see we have a good outcome in one of our patients that we treated by injecting PRP. If you look at the lower image, you'll see that where that hole was, that black area has resolved, that tendon has healed, and that patient's pain is resolved. Sometimes patients come in with larger tears. This is a patient of mine who plays on the PGA Tour, professional golfer, who's on the Champions Tour, who had a complete tear. So you hear about tendon tears, they come in different sizes. This patient had a complete rupture of the tendon. It actually had pulled away from the bone. I advised the patient to undergo surgery. He advised me he had no interest in surgery. And even though he had trouble raising the arm, he could not play golf. He didn't want to undergo surgery. So I shared with him that I had had some good experience using cells from fat. So we injected some of his own cells from fat into the tendon. And here you can see on the left, a very large hole. You can see the needle coming in from the left, injecting fat cells into the defect, that black area for the defect, and the white round area is the actual fat graft that I injected. And then here he is 1 year later. Even though his symptoms had resolved by 2 months, we decided to scan him a year later, and you can see that tendon is virtually completely healed. And that's quite a remarkable finding. Next slide. This is one of our colleagues, Dr. Oliver in St. Louis, Missouri. She injected a patient with an Achilles tendon tear. Again, you can see the large black area in the middle of the screen on that top image. And then after treatment, and I believe it's 3 months after treatment, that Achilles tendon has healed. So that's the nice thing about ultrasound is we can actually scan you in the office and see in real time the effect of the healing. Kind of like if you were looking at a wound on your skin, you could see over time, you could see the skin healing. Next slide. There's another patient of mine who's a professional soccer player. He actually plays for San Diego. And he had received a number of treatments at other clinics. When he presented to our clinic, I diagnosed him with this large tear in the tendon in his knee. And even though this is not a rotator cuff tendon, it's still, the concept is that we're using cells to regenerate tendons. And this is a high level performance athlete, running on the court, for a long period of time. And he was not able to do that. And then 3 months after treatment, he was able to do that. He's been fine since. It's actually been probably 4 years now since I treated him. He still plays competitive soccer. And this is also another impressive image. This is one of our pickleball players, not a professional pickleball player, but an avid pickleball player, very competitive athlete. And she basically ruptured the tendon from her elbow, right? You've heard of tennis elbow, where you might have a little tendonitis. She actually ruptured the tendon off the bone. You see that large black hole with the arrow pointing to it. And then remarkably, 3 months later, after a combination of PRP and fat-derived cells, we were able to regenerate that tendon, which again is a remarkable finding for such a severe injury. So as you would imagine, most patients are trying to avoid the hospital setting right now, unless they're getting vaccinated. They really don't want to go to the hospital. And this study done at Johns Hopkins University estimated that there's going to be 7 to 16 month delay in treating all those patients that require elective surgical treatments, such as knee replacements, hip replacements, shoulder replacements. And because of the pandemic, there's been this backlog, because people weren't going to the hospital for months. So for a variety of reasons, it's difficult for people to get surgery, or they may not want to get surgery. And so we provide a nice alternative to help them, at worst, get temporary relief for several years, at best, cure them outright without the need for surgery. And that's been keeping us very busy these last several months. So now we'll take your questions. I see a couple have already come in, but maybe Dr. Ambach, I'll let you just take the lead here.
Okay. Let me go to the question and answer. Sorry, when I was sharing my screen, I couldn't see the
okay.
the
Well,
questions.
I'll take one. A really good question that came up says, how do I know I have a rotator cuff issue, and what are the cardinal signs? And I'll make two comments about that. The first is patients with rotator cuff tendon injuries, more often than not, 90% of the time, is sort of an insidious thing. So, 10% of the time patients say, I fell, or I hit a bad golf shot or something, I felt this pain. But the vast majority of folks say, I've had this nagging pain, just gradually getting worse, it's not going away. Typically, the pain will be over the front of the shoulder and may radiate down to the upper arm area. That's not at all uncommon. Another common area that patients might feel pain is in the back of the shoulder. And these pains are sort of deep, aching. Patients may say it feels like a bone pain. It's so deep because after all, the tendon does attach to the bone. It's very common for patients to say, if I get my arm in just the wrong position, it hurts, if I reach forward to pick up something heavy, or if I reach behind my back, or if I'm putting on my shirt. Another common thing we hear is if I go to sleep at night and try to lay on that side, that's very painful. So these are all very common symptoms that we hear from patients. However, to get an accurate diagnosis, you really need to do that ultrasound examination in the office. The ultrasound is highly sensitive, highly specific, very accurate for detecting tears. I don't think people realize it's actually more accurate than MRI. MRI does not have the resolution that ultrasound has. So in skilled hands, Dr. Ambach and I go around the world. Well, before the pandemic, we would fly around the world training doctors how to use ultrasound because there is a learning curve to that skill. But in good hands, that ultrasound is a great tool for diagnosing tendon injuries. And sometimes we're surprised. We find more than one injury. Sometimes the injury is more severe than we thought. Sometimes it's less severe than we thought. Sometimes there's a bursitis, which is an inflamed bursa. So it's important to do the imaging as well as the physical exam in the office and taking that history.
So there's before we proceed to the question and answer, we do have a Ask the Docs series. If you don't want to listen to a lecture, sit and listen to a lecture, and you just want to get your questions answered, we do this every first Wednesday of the month. It's live on Facebook, so you can type your questions and comments, and we can answer them every first Wednesday of the month, 12:30, and we have certain topics every month as well. If your questions are of a more personal in nature, we would prefer that we talk to you and answer those in more detailed. So you can call our clinic or email us, and we'll provide you all the information to be able to contact us. All right, so moving forward with the questions, there's a question with regards to someone who has cancer, and is this contraindicated for these cell therapies? So there hasn't been any studies that have shown that PRP or bone marrow derived cell therapy or other cell therapy from fat tissue has shown proliferation of abnormal cells or cancer. So nevertheless, whenever a patient tells us that they have a history of cancer, whether it's a remission or a remote history, we always consult with their oncologist and inform them that we are doing a procedure. And 99-100% of the time, the oncologists don't have a problem with us proceeding with the treatment as long as they don't have active cancer. If it's treated, then there shouldn't be any problem to proceed. Do you have anything to add to that, Dr. Rogers?
Well, it's very reassuring that we now have, more than a decade and a half of data from bone marrow derived cells, and we have about 7 years data from fat derived cells, and decades of data from PRP on the issue of, can these cells cause cancer? There's very good evidence that that does not happen. These cells do not cause cancer. on the question of, hey, these cells are producing growth factors. Could they stimulate a tumor to grow? In lab rats and in petri dishes, that seems to be a reality. But in the clinic with cancer patients, it does not appear to be a reality. There's actually some really interesting data looking at women who had metastatic breast cancer, who had mastectomy, and then had breast reconstruction surgery augmented using stem cells from fat, showing no increased recurrence rate in breast cancer. And so in that area, so there's good data. As your doctor, I take every precaution to avoid bad things happening. So consulting with our oncologist, looking at all our options. We're cautious. I think for the first 6-7 years, I didn't treat anybody who had any history of cancer. Now, if the cancer has been stable for 5 years or longer, we don't worry. I think 10, 20 years from now, we can say unequivocally that there's no evidence that we increase the risk of spreading that cancer. But again, it should be an individual decision that we make with the patient.
Next question, is it helpful to get physical therapy after the injection, or is there a waiting period? So as the first phase of that healing process, your body goes through what we call an inflammatory phase, wherein the structure that was injected gets a little bit more sore than usual. It may feel that it's swollen, although it's not swollen. So in that period, you're going to be limited with regards to lifting or doing anything strenuous. Usually for the first 3 to 5 days, we ask you to just take it easy, just do your stretching. And physical therapy usually typically starts at 5 days, 7 days, about a week after the procedure. So yes, the physical therapy is as important as the injection itself. We do have specific rehab protocols for patients to undergo the procedures, and we are in contact with your physical therapists and give them what our protocols are. And it's very important that you follow through, because that helps your body to assist you in healing in the right direction.
Yeah, physical therapy is critical for really 3 reasons. The first is maybe not so obvious. When you inject cells into a tendon, the forces on that tendon, the tension that occurs in that tendon, informs the cells how to lay down these collagen fibers in a way that makes the tendon more functional. If you were to do absolutely no exercise at all, it's very possible those cells would create a blob of collagen tissue that is maybe not a very functional tendon. So that's one reason. The second is, most of my patients who've had injuries for 3 months or longer have some degree of deconditioning, some weakness in the joint. And so reconditioning is critical. And patients who were not able to tolerate physical therapy before the treatment can generally tolerate physical therapy after the treatment once some healing has started to occur. And that's great, because they need to get reconditioned. And then the third reason is, you have to ask the question, why did that tendon tear in the first place? If it wasn't a trauma, what happened? And it was repetitive micro trauma, perhaps from a dysfunctional joint. And so what do I mean by that? Maybe that joint was a little too stiff. Maybe the shoulder blade function was not proper. And so it set the patient up. It's almost as if the alignment on your tires in your car are off just slightly. That tire is going to wear out a little bit quicker. So we want to address the core cause as well as heal the injury. So physical therapy is critical for all our patients.
Next question. I have a 10-millimeter loose body of cartilage floating around my shoulder and a rotator cuff tear. I've been told I will need surgery to remove the loose body because it's too large to be reabsorbed. Can cell-based therapy help to avoid surgery? So loose bodies can be either, as in this particular case, it could be a piece of cartilage, could be a piece of a synovium or that lining in your joint, or it could be a small piece of bone tissue. And probably more than half of the cases of patients who get loose body don't have symptoms from them. If they become to be too large, or they get stuck in a position in your joint or in your tendon that creates symptoms, then that's when you start feeling pain or locking or stiffness in your joint. And that's when you start to need to treat them. So large loose bodies like this, they can't, the only way that you can take them out is through either cleaning them out with an arthroscopy if it fits in the scope, depending on the size, or have them surgically taken out. The cell therapies, the injections that we do not dissolve these loose bodies. They can help with your rotator cuff tear. As you indicated, you have a rotator cuff tear problem here, so it can help with that, but it's not gonna make your loose body go away. Again, the most important part of the evaluation is to find out what's causing your pain. Most of the time, loose body is just an incidental finding that we see on the MRI. That's not even, the issue. So,
Well, a loose body could also be a sign of osteoarthritis in the joint, and now osteoarthritis is a secondary source of pain over and above any tendon issues. And so when we treat, we customize the treatment to your issue. So if you just have a small rotator cuff tendon injury, we're going to treat that rotator cuff tendon injury. However, if you also have osteoarthritis in the shoulder, cartilage damage, loose cartilage, even loose bodies, we're going to also treat the joint. I don't know if this patient has had cortisone injection in the shoulder, but a lot of orthopedic surgeons like to still use cortisone injections. And if you had temporary relief from a cortisone injection, that would imply that perhaps PRP might work as well, or last significantly longer than a steroid injection.
All right, next question for you, Dr. Rogers. From my understanding, stem cell does not work as good as you get older. So if you're taking it from my body and using it and I'm going to be 70, what's the success rate with that?
Well, it's an interesting thought, and it's something that we all thought about maybe 10 or 15 years ago when we were first learning about how cells work. We do know that as we age, the number of stem cells decrease. Of course, when you're babies, you're just chock full of stem cells, because the stem cells do two things, really. They don't just help you heal, they actually help you grow as a baby. So when you're a baby, you got to get to a teenage size and adult size. That's what the stem cells are doing. They're replicating cells. How do you get from 1 trillion cells to 37 trillion cells? Stem cells get you there. So as we age, we have less stem cells. That is true. It's probably also true that those stem cells are less functional, meaning they don't produce perhaps those growth factors as well as a younger person might. However, having said that, we have some outstanding results in people who are older. And I'm talking about 80 to 90-year-old people. For example, there's a study that looked at patients with severe knee osteoarthritis who were treated using their own cells from fat. And the 80 to 90-year-olds did just as well as the 50 to 60-year-olds. So there's really no evidence that older people are worse off in terms of their outcomes. I think the real issue is as we get older, there's other covariables, I think, to consider. The injuries may be more severe. There may be other medical conditions that we need to be aware of, medications that we need to be aware of. And so I think there's a correlation with age, but I don't think just being a healthy 80-year-old precludes you from having a great outcome.
Thank you, Dr. Rogers. Next question. If I had a rotator cuff tear several years ago and surgery is recommended but did not due to osteoporosis, is it too late to try to have PRP now? I'm a swimmer. No, the simple answer to that is no. We have treated a lot of patients that had rotator cuff tear that they didn't even know they had until they just did, something work on their yard, took out their Christmas tree decorations, and they flared up their rotator cuff. And when we do imaging studies, we have found that they had a tear all along. So we can still treat these patients and make the tendon stronger and help heal that rotator cuff injury, if that is indeed what's causing your pain. Next question, Dr. Go ahead.
I was just going to add, and by the way, it's never too late to do cell therapy. It's a very safe treatment. It's probably the safest medical treatment we have right now. It's probably even safer than taking Tylenol or Advil, because we just don't see complications with PRP. We don't see complications with these cell therapies, which is very reassuring for doctors and patients both. Another question we get asked is, can it or should it be repeated? And I would say 90% of the time we do not repeat the treatment. It's not necessary. Usually one treatment, if you do the correct thing at the correct place with the correct biologic, you get a good outcome. But there are some patients that their tendons are a little bit more stubborn than others, and we might have to go and do a little booster shot. And the nice thing about doing a booster shot is, unlike steroids, which there's a limit, you can only get so many steroid shots per year. There's really no limit to how many times you can put cells in that tissue. But the real good news is it's not really necessary most of the time to repeat it.
Next question for you, Dr. Rogers. The chart on PRP gave me a good impression of how it works overview, multiple growth factors in the blood. How does stem cell therapy work? Is it the same thing with growth factors derived from fat instead of blood? Any other difference or mechanisms involved?
All great questions. We could do 10-hour lecture on the biology of stem cells. Suffice it to say that there are some key differences and there are also a lot of similarities. So for example, platelets release, like Dr. Ambach said, thousands of growth factors. These are synthesized by the platelets and released. The platelet cell tends to die within 7 to 10 days. By the way, that's happening anyway. If someone says, how old are you? You say, well, my platelets are only 10 days old. You know, you're constantly refreshing these cells. When we inject platelets into your tendon, they are gone within 10 days, but they release growth factors that talk to cells in your tendon. And then those tendons take the baton, you know, the platelets pass the baton to the cells, and then those cells continue the work from there. Stem cells also secrete similar molecules that do similar thing. We have evidence that stem cells stay in the tendon, stay in the joint longer, several months, perhaps as long as 6 months. So they perhaps that's one reason why the results tend to be better with stem cell therapy than PRP therapy, because they're acting over a longer period of time. They also have many more superpowers than platelets. So there are things that stem cells can create, molecules they can create that platelets cannot create. But it's extremely complicated. You go researching the biology of stem cells, it'll make your head spin. We are exquisitely complicated creatures.
What radiologic exams are needed prior to consultation? Does the practice take VA or TRICARE Prime insurance? Yeah, so depending on your condition, we can either do regular x-rays, musculoskeletal ultrasound, or MRI. As Dr. Rogers have explained, soft tissue injuries in your joints or in the peripheral extremities, the ultrasound has a really good sensitivity and specificity in identifying these injuries. In fact, with tendon injuries, we can see small tears earlier or better with ultrasound than MRIs. If we want a bigger, more detailed picture of your joint and we want to image deeper structures in your joint, we tend to favor doing an MRI for those conditions. So that's what we do. It really depends. It's not a one answer fits all. Depends on what you need and what your condition is. We take all PPO insurances and Medicare for now. VA or TRICARE Prime insurance, we take that if I'm not mistaken.
Sure, we take TRICARE Prime. Yeah, you got to talk to people smarter than us in our office. Yeah, just call Andrea at the front desk. She'll tell you whether or not we take your insurance. If we don't take your insurance, we charge for a consult, either by Zoom conference, you know, where we talk to you through the computer, or you come in the office for an exam, and then we'll credit a portion of that consult against any treatments that we offer you.
Yes, unfortunately, these procedures are still not covered by insurance. Hopefully in the next 3-5 years or so.
I've been saying that for 12 years or longer, you know, 3 more years. People say, why not? You know, there really is no good reason. PRP has been very well studied, particularly for knee osteoarthritis. There's more evidence for PRP for knee osteoarthritis than there is practically for any other treatment of knee osteoarthritis. And yet insurance still does not cover it. The explanation is beyond me. It's above my pay grade. I don't know what people are thinking, but it will happen. It will happen. It's just a matter of time.
The cost of these procedures, for to answer one question here, is anywhere from $500 to $1,600. It depends on the number of body regions we are injecting and what treatments you're getting. And we're pretty good at trying to accommodate patients who had multiple procedures done or will need help with regards to payment plans, etc. Next question, Dr. Rogers.
Yes.
Is from it definitely will happen. Acupuncture. Oh, I'm sorry. This one is not related to our topic, but this is regarding a spine fracture with regards to the use of PRP.
I see.
I think we have covered, we're pretty good at doing this question and answer portion now, Dr. Rogers. We're
Yeah.
going to these questions really,
Great questions,
really
everybody.
well. Yeah.
Yeah, we've covered the safety. I think the first question you should always ask a doctor when they recommend something is, what's the safety? What's your experience? Have you had complications? That's, we take an oath to do no harm. So we're very happy to be able to offer these treatments, which have been shown, not just in our clinic, but in clinics around the world, to be very safe. I mean, it's somewhat intuitive that using your own cells would be a benign thing to do. There is discomfort, as Dr. Ambach mentioned. When we inject the cells, we do everything we can to do it with high precision and high comfort level, and I think we do a good job of that. But these cells, they have a mind of their own, and they can produce inflammation for a few days, which is usually managed well with Tylenol or ice. And then once that passes, then it's just a matter of waiting for the tissue to heal itself, which can be very quick. If you're a 20-year-old person with a small injury, 4 weeks, probably back to doing everything you want to do. If you're older and you have a larger injury, it's going to take more time, but most people get there. And as soon as we get all the doctors around the country trained, which is a big undertaking, Dr. Ambach and I are very passionate about this, and we've trained hundreds of doctors over the years. But there are many more thousands that need to be trained. And once we get insurance to pay for it, this will be the new standard of care. This is going to replace a lot of things that we've done for decades with less good results.
If you have any more questions, feel free to reach us at our email admin@sdomg.com. Otherwise, if you want to ask us about questions regarding any other orthopedic conditions or cell-based therapies like platelet-rich plasma or therapies that are derived from adipose or bone marrow tissue, we do a live question and answer portion for 30 minutes every first Wednesday of the month. And we discuss the specific topics every month. And if you follow us through Facebook, we will publish the topic for next month in just shortly here. And I think that would cover it all, Dr. Rogers. One more thing I wanted to remind patients is we do have a YouTube channel that we have all our educational videos on different procedures, different conditions. All our webinars and our Ask the Doc series are also recorded and are posted in the YouTube channel. So if you missed a portion of this recording, feel free to go to our YouTube channel and access it from there.
Great. Thank you, everybody, for taking time out of your day, an interesting day to learn more about this. We look forward to helping those of you that need our help, or if you have any friends or family, we're happy to take a look. And if we can't help them, we know a lot of good docs in San Diego that might be able to do whatever it is you require.
And for those patients that would need surgery, we also know a lot of good surgeons that we can refer you to.
That's what I meant. Yep.
Thank you, everybody, for joining us. And till next time, have a great day. Bye-bye.